From the San Francisco Public Press, you're listening to Civic. Homelessness and record-high overdose deaths dominated policy debates during last year's race for mayor of San Francisco. And election results made it clear. In the court of public opinion, clearing the streets takes precedence over helping drug users consume more safely. Now the San Francisco Police Department is taking a lead role in getting people off the streets in areas with the most visible quality of life issues.
Shootings, homicides, robberies, burglaries, they're going down. That all doesn't matter if you don't feel safe.
It's a contentious approach that's widened the ideological divide between public health experts and housing advocates on one side.
How do we embrace this community, bring it in, instead of just throwing more toxic crap at them?
And small business leaders on the other.
A nonprofit can take care of it. Who are they kidding? As long as there's homeless out there on the street, that's how they make money.
I'm Sylvie Sturm, and this is Civic. In late March, I took a stroll along the beleaguered 6th Street corridor in San Francisco's South of Market neighborhood. I walked by tired-looking people sitting on the pavement or on camping chairs. Some were huddled in small groups, others sat on their own among bags of personal belongings. I also saw several officers strolling along the street, from the police and sheriff's department and adult probation office. Crime in San Francisco last year plummeted far faster than it did in any other same-sized city. Even car break-ins are at a 22-year low. And over the first 3 months of this year, crime has continued to fall in all categories, according to police data. But law enforcement is swarming 6th Street nonetheless. To explain why, here's San Francisco Assistant Police Chief David Lazar at a town hall in South of Market in February.
Shootings, homicides, robberies, burglaries, they're going down. That all doesn't matter if you don't feel safe.
Lazar was there to announce a new strategy to address homelessness and drug use in the area. In February, the department transformed a 6th Street parking lot into a so-called triage center, a fenced-off area where police could connect people to social services or put them in a transport van headed to jail. In the first month of the strategy, police made 350 arrests, 3/4 of them drug-related, according to a city staff report. Triage personnel also connected 275 people to shelter and 408 people to healthcare. But some housing advocates say the center's not improving on the status quo. Here's Jennifer Friedenbach, Executive Director of the San Francisco Coalition on Homelessness.
The service providers were basically ordered there as part of their contract, and they are doing the exact same work inside the cage as they were doing outside on the street. Code Tenderloin gets a certain number of shelter beds and treatment slots that they can place people in. They always fill them all up, and they're just doing that same exact thing now inside the cage. So it's a little bizarre, I think, from our perspective. It just seems like optics to kind of shame people who are out there. We want a decent street response that is effective and humane. And the proposed street response with this administration is far too tied to enforcement and not at all tied close enough to the data-driven practices that need to happen. And so, San Franciscans, I think, deserve real solutions.
The center is also open to anyone who wants to drop in. I talked to a local SRO resident leaving the center holding a cup of coffee. He asked that I withhold his name.
First time I went there, I just got coffee right now just to check it out. I thought it was great. It's a safe place. It's always been a little shady here. It's alcoholic, but it's never like this. I don't know. It's a drug crisis, and it's everywhere. At about midnight to 7 in the morning, the police allow people to come out here. It is out of control. You should come out here about 2 in the morning, or when I come out of my place at 7 in the morning, there's people, mattresses. It's totally different. Addiction is not fun. These are nice people. Yeah, it's dirty. You just can't judge people. People got a soul. So these are humans. And I think a lot of people do these things because you are stressed on the streets, and it is a way, what came first, the homelessness or the substance abuse problem? I tend to think you become homeless and then you develop a substance abuse problem to cope with the life on the streets.
He's right. A large portion of California's homeless population begin using drugs regularly after they lose housing. That's according to a sweeping UCSF study conducted in 2021 and 2022, with responses gathered from 3,200 questionnaires and 365 in-depth interviews. It was the largest representative study of homelessness in the United States since the mid-1990s. Investigators found that just a third of participants used drugs, and less than half of them began using regularly only after their first experience of homelessness. It turns out the predominant driver of homelessness is severe financial instability, not addiction, as commonly believed. The study's participants had a median monthly income of $960 before becoming homeless, and 3/4 of them lived in the same county where they were last housed. Many study participants believe that rental subsidies or one-time financial assistance could have prevented their homelessness. Here's Friedenbach again.
Even though we have less substance use and addiction here than in other areas. A lot of the other big cities around there have much higher rates of overdose, much higher rates of substance use disorders, but they have cheap housing, so they have lower rates of homelessness.
But very few of the dozens of residents and business owners who attended the town hall in February expressed concern for those on the street. Elizabeth Chi is a lawyer who lives and works near 6th Street.
I'm kind of heartbroken. The inequality gap is just going to get wider and wider. And I think no one is talking about the actual issues. Everyone would like to think I would never be that person, but people that you and I know end up in that situation. And I think it just completely misses the mark. I feel like the people in this room think that it's a matter of morals, or just someone needs to force this person who is just bad or weak or not trying hard enough and punish them to get them to stop using drugs, and that's going to fix things. And that's just not the case. These are people just like us who are trying their very hardest, who have been failed by the system in so many ways. And now they're going to get persecuted again. It's not actually as easy as I think most people think it is to get services in the city. Even though they're available, they're not always the most easy to navigate. And so, I think that funding would be much better allocated to actual, medical services, housing, food, general assistance in the city recently got bumped up back to $714, but can you imagine living on $700 a month here? That's impossible.
A common theme among elected officials is that people choose to live on the street.
The homeless have no right to turn every park and sidewalk into a place for them to squat and do drugs. Americans should not have to step over piles of needles and waste as they walk down a street in a beautiful city, or at least once beautiful city.
Here's Daniel Lurie appearing on ABC 7 News in October, a month before he was elected mayor.
And I'm going to send a message every day for as long as it takes to set in so people hear across the country and across the world that you don't come to San Francisco to deal drugs, you don't come here to do drugs, and you don't come here to sleep on our streets.
Last year, San Francisco had just over 3,200 beds for a homeless population of 8,300 people, more than half of them unsheltered. And last year, more than 20,000 people sought homeless services. But with increased stigmatization and an intense focus on the cost of solutions, compassion fatigue is sweeping the city. Here's Henry Karnilowicz, president of the South of Market Small Business Association.
I came from Australia. Nobody gave me anything for me. And I own a building. I own a house. Very lucky. But you know what? I did it. And here's people saying, oh, these poor folks. Well, that's because they had a problem in their family. They had a problem somewhere along the way. But don't just sort of say, oh, now we've got to give them everything. We've got to help them. That is very, very, very true. But we can't just allow this to continue, because it's not good for them. It's not good. Do you want to see someone die right in front of you, in your doorstep? No, you don't. I don't. Definitely not. I want to look. Here's an example of some homeless people. So there's a food truck more or less. It's a permanent one. And I'll never forget how we had this one homeless woman. She would come out there and give her a job sweeping up the sidewalk outside. Now, she wasn't very reliable, but she did it. So reach out, do that sort of stuff. I'm so fed up with everybody just oh, the cops are bad. The cops are bad. Oh, a non-profit can take care of this. Who are they kidding? It's a non-profit that's causing the problem. It's a business for them. That's how they make money. As long as there's homeless out there on the street, they're jobs. I don't think people should be put in jail just like that. No, not at all. I'm very compassionate.
Nevertheless, that is what's happening. The San Francisco Chronicle compared police data in January and February of 2025 to the same period last year. Their analysis found that arrests involving suspected drug use, not drug dealing, jumped 40%, from 692 arrests last year to 963 this year. One charge has become especially popular for removing people from sidewalks: loitering to commit controlled substance offenses. Over the past decade, officers rarely arrested people for drug-related loitering. We're talking low double digits. But in the first 3 months of 2025, the Sheriff's Department logged 193 jail bookings for the offense. Homelessness advocates talk to people who were approached by law enforcement. Here's Friedenbach again.
There's been a lot of quote gathering from folks that has been really powerful. I'll read this one. That's a fundamental problem right there, that we simply don't have homes, a place to live. It's illegal to sleep in the city now if you don't have a home or even sit or lie down, and that's exhausting. On the street, with all the craziness, it's high anxiety out here every day. And now it's gotten worse with this mobile command and the police everywhere. I can't be myself out here. I've never been homeless before, and it's been so hard the past 2 years. Here's people who clearly don't want to be out there, who are not enjoying themselves. In no way can you call that the party. That narrative around drug tourism just completely belies the roots of substance use disorders and the real severe trauma that folks that suffer from substance use disorders face.
Police officials say that mass arrests in troubled spots have reduced public disorder, at least for now. But residents at February's town hall say the problems intensified for them after police began mass arrests in other areas.
This is a 7-month displacement issue that resulted from the clearing of Market, UN Plaza, Civic Center, and it landed on our streets. And so we've been I've been at UN Plaza for 18 years and I've never seen it like this.
Some residents predicted that the 6th Street plan would just cause other neighborhoods to see a surge of displaced people. Lazar didn't have an immediate answer for their concerns.
If the model works, we can copy and paste it, or actually cut and paste it somewhere else. If that's the issue, we just have to see.
Meanwhile, people who work with defendants say overcrowded and understaffed jails severely limit access to rehabilitation programs like drug treatment and even cause them more harm. Angela Chan is Assistant Chief Attorney with the Public Defender's Office.
We have 3 jails in San Francisco. CJ2, which is our main jail downtown, is at 100% capacity. CJ3, which is our larger jail in San Bruno, is at 116% capacity. CJ1, which is the intake facility in downtown, the population is 21 for that smaller intake facility. What we're seeing is that these are individuals who are often dealing with a substance use disorder, withdrawal in some cases, and they are really going through a lot of pain in the jail. It's very excruciating and agonizing what they're going through in terms of this acute withdrawal without sufficient treatment. And then people are being released not to treatment. And so it's a lot of shock and awe in terms of these social media videos propagated by SFPD, but it doesn't lead to people getting treatment, and it doesn't lead to a reduction in substance use disorder. What we've seen is an increase in drug overdoses overall in the city. And so it is very concerning because it's not just political theater, but it's political theater that's causing harm.
None of that is of police concern, Lazar said.
We will continue to arrest people, and we're not really concerned about jail overcrowding at this point. That's not going to stop us from doing what we need to do. Holding all of us accountable to do a great job. Our mayor is all about making sure that we clean up our city and we help people.
But the strategy isn't exactly aligned with the new mayor's campaign promises. In 2024, San Francisco residents voted for Daniel Lurie, the billionaire heir to the Levi's fortune, whose past philanthropic work helped create 145 units of permanent supportive housing. Here's Lurie talking about his plan to address homelessness and addiction on ABC 7 last October.
We need to pull our police officers back from being the first responders to somebody who's in the throes of crisis, of mental health or drug addiction. I want trained clinicians going out first, bringing people into a 24/7 crisis center, and then deploying them to beds, detox beds, step-down beds, programs like Salvation Army's The Way Out program.
One of Lurie's first acts as mayor was to propose a fentanyl emergency ordinance, which the Board of Supervisors passed with a vote of 10-1. With the board's endorsement, Lurie's administration now has the power to enter into service contracts addressing substance use disorder, mental health, and homelessness without going through competitive bidding, which can take months. It allows city departments to sign new leases without board approval, potentially involving $1 billion worth of grants and contracts. City legislative analyst Nicholas Menard warned supervisors that waiving competitive bids would likely increase service costs and, quote, create opportunities for waste, fraud, and abuse. In December, a city audit found that police overtime costs had surged to $108 million amid poor oversight and abuse of the system. In March, Lurie proposed that an additional $61 million go toward police overtime, along with $30 million for the sheriff's department. Nevertheless, Lurie said in March that he's keeping his eye on the bottom line.
This new roadmap has 3 core goals. Get people off the street and connected to services so they can achieve long-term stability. Keep our public spaces safe and clean. Hold City Hall and our partners accountable for results while responsibly managing taxpayer resources.
Whether police should lead street crisis response is not a new policy debate in San Francisco. During a police commission meeting in February 2024, Commission Vice President Max Carter-Oberstone debated Police Chief Bill Scott on the effectiveness of arrests as a solution to homelessness and addiction.
The public is demanding that something be done. And I think that there's consensus that something needs to be done, and folks who live and work there are justified in the way that they feel. But we also have to do something that's evidence-based. And, I'm not by any means a public health expert, not going to claim to be tonight, but the folks who are advocating for this strategy, as far as I have seen, have not produced any evidence showing that arresting drug users produces positive outcomes. On the other side, the folks that are opposed to this have cited just a litany of high-quality studies showing the grievous harm that this strategy has wrought when it was implemented in cities all across this country. And so I understand the exasperation, but how can that possibly justify engaging in what looks to be, a misadventure, to put it politely, but something that's been proven, not to work over the years? How can we justify that?
If there's a better solution out there, I would love to hear it.
Okay, I'm going to give you one right now.
But let me just say this. And when I say a better solution, we have police officers that day in and day out get called or asked or demanded to, like last night, the lady was so upset that her hands were shaking and tears came out of her eyes. She said, I can't even get in my house, my apartment building, because I'm stepping over people passed out from use. I got drug dealers in the midst of this. I need your help. I need this department's help. Now, those studies probably will address, or at least the public health studies, the addiction piece of this, but they don't talk about the now piece of this, what needs to be done now so that lady can get in her house. And to me, that's where the San Francisco Police Department can come in.
I don't think there's any disagreement. There's no studies supporting what we're doing now, because the folks who are supporting this have been asked many, many times and they never have an answer. It's just anecdotes. But you asked for a potential solution. And so in preparation for this meeting, I looked at the SF Street Level Drug Dealing Task Force report issued in June of 2021. The San Francisco Police Department was a member of that task force, as was the District Attorney's Office, as was the Public Defender's Office, as were various community members who are expert in this area. They issued a very long report with many footnotes filled with the studies that we're talking about right now. They had 6 main suggestions, and none of them included arresting drug users. And all of them, all of the points take pains to delineate between, dealers and users. And there's, opening a linkage center, coordinating all agencies and service providers in District 6, more services, things of that nature. A deep review of the evidence and consultation with experts. Apparently no one in the room proposed more arrests of drug dealers.
We did. Didn't make it in the report.
1 year later, in a highly unusual move, Lurie submitted a motion to the Board of Supervisors to remove Carter Oberstone from the commission. Lurie didn't specify why he wanted him out, but he said that he wanted commissioners who would, quote, work collaboratively to make our city safer. The board voted 9-2 in support. After police opened the 6th Street Triage Center in February, hordes of displaced people moved elsewhere, just like some had predicted. This time into the Mission District. The Gubbio Project in the Mission helps connect unhoused people to social services and medical care while providing a safe space for rest, coffee, breakfast, blankets, socks, and hygiene kits. Lydia Branston is the executive director.
We have seen a doubling, if not a tripling, of people coming to our program. We document every time we talk to someone within the block of our program. So January, we did 1,020 something to either invite them into our program or ask them not to use drugs in public areas, or let them know what the resources were in the neighborhood, help people clean up their stuff if they're on the street, inviting them in to come and sleep inside, all that kind of stuff. About 1,020. February, we did over 5,000. The alleys have become incredibly crowded, with sometimes up to 100 people trying to be discreet. You see a group of people sitting on the street huddled together, like as a disaster. I see it as a community. I was like, how do we embrace this community, bring it in, and see if we can we can add some health to the community instead of just throwing more toxic crap at them, right? No one wants to hear the conversation about the struggles of people who are using on the streets. People want it to stop by any means necessary. And so what we're doing now is responding to that push. So as city government moves people from place to place, what's happening on the front lines in organizations like ours is that people are experiencing more stress. So when you experience more stress, drug use goes up, not down. Behaviors are escalated. There's more violence, and there's more overdoses, and more ambulances, and more calls for emergency services. And the places where people who are in emergency go are busier.
And that's just what happened. City data shows that 911 dispatched 900 calls for service in the Mission in March. That's the highest number in the decade of data available. Now police have stepped up enforcement there out of a bus-sized mobile command unit parked in the middle of the BART Station Plaza at 16th and Mission Street. Lurie announced a series of initiatives in March.
In the next 100 days, we're going to overhaul how the city organizes our street outreach efforts, replacing a fragmented structure with neighborhood-based teams that have the tools to connect people to treatment while keeping our public spaces clean. We will keep adding capacity in our systems so someone sleeping on the street or in their car has a better option available. And we will work on getting people off the street and into a bed, and then through our system and into an environment where they can be provided long-term stability. Then, in the coming months and over the next year, we will improve our case management and data systems, because we should consider a person's health needs when we're identifying the best permanent housing option.
Lurie also announced a new direction away from the city's long-standing harm reduction policy. The public health approach attempts to minimize the most harmful effects of drug use without necessarily requiring abstinence. His first action was to end the distribution of fentanyl smoking supplies without first enrolling clients into counseling and treatment. The supplies were considered safer because smoking fentanyl reduces the risk of overdoses and infection compared to injection. Supervisor Matt Dorsey, who's been outspoken about the need for a more forceful approach to drug use, celebrated Lurie's directive.
Reversing years of perverse incentives that have done more to exacerbate problems than solve them. Mayor Lurie's directive is taking aim at some sacred cows, including harm reduction and homeless spending, what we're prioritizing, that frankly deserve scrutiny, because these are approaches that need to be held to account for why they're not producing better outcomes.
In 2020, the COVID-19 pandemic worsened both homelessness and fatal overdoses. Since then, overdoses have killed more than 3,000 San Francisco residents, more than COVID-19, homicides, and car crashes combined. Those deaths began decreasing last year and hit a monthly low of 37 in October. Several factors may have contributed to the reduction, including robust harm reduction strategies, like widespread distribution of the overdose reversal medication naloxone, an educational campaign warning users of the threat of fentanyl, and more than 400 new beds in residential care and treatment programs. But deaths are again on the rise. 61 people died of overdose in February, and over the past 6 months, deaths have increased 35% from the previous 6 months. It's unclear how far Lurie intends to move away from harm reduction, but abandoning the approach goes against the advice of many public health officials who work in the field of addiction. In March, 4 UCSF health professionals held a webinar to explain why harm reduction is a crucial approach to drug treatment. Dr. Alexis Bazazzi stressed the need for harm reduction services to engage people in treatment.
We've admitted in the last year and a half about 1,000 intakes, and I can count on 2 hands the number of people who did not report accessing harm reduction services prior to coming into treatment. It's not causal, right? Like I can't say, that doing harm reduction makes you go and into recovery and into treatment, but I can tell you that if you are accessing treatment, you probably already accessed harm reduction services, at least in the case of opioid use disorder.
Harm reduction is a key pillar in what's known as the Zurich model, along with prevention, treatment, and enforcement. The strategy is based on Zurich's successful approach to ending its fatal drug overdose and open-air drug crisis in the 1990s. Mission District Supervisor Jackie Fielder called for a public hearing on the Zurich model in March.
One of the key lessons from Zurich is the deep collaboration between law enforcement, public health officials, and social service professionals working together, side by side, day in and day out. This is not about choosing between public safety and public health. It's about bringing them together. We cannot continue to push the problem from one part of the city to another. We cannot keep relying on 1 or 2 strategies when we know that it takes all 4 working together.
The hearing has not yet been held. I'm Sylvie Sturm, and you've been listening to Civic. Civic comes to you from KSFP LP 102.5 FM in San Francisco, a project of the San Francisco Public Press, a nonprofit investigative newsroom. Find the accompanying article for this episode and all our reporting at sfpublicpress.org. Our theme music is by John Dillon. Additional music was supplied by the Blue Dot Sessions. Our team includes KSFP Program Director Mel Baker and Executive Director Lila LaHood. Civic airs Tuesdays and Thursdays at 8 a.m. and 6 p.m. on KSFP. New episodes on Thursdays. Find everything going on with Civic and the San Francisco Public Press by signing up for our newsletter at sfpublicpress.org/newsletter. Thanks for listening.